Are you looking for some OET speaking tips and tricks as well as a real role play example? If yes, you're in the right place. My name is Rachel. I'm a certified OET preparation provider bringing you the practice and the advice that you need to successfully pass your OET. In this video, we are looking at this role play, and I want to point out a few things before we go and watch the full doctor-patient role play. So the first thing to notice is who is our patient and what is the context. And this will help us establish an appropriate introduction and get our role play off to a good start. So a couple things to notice. We have a parent and a 6-year-old girl. Now, the examination we see here, it says you have just completed a physical examination of the child, and the child is not present. So we are having a conversation with the parent about the child's exam results as well as some follow-up questions and concerns. And notice here it says you have just completed a physical examination. Well, that means we're in the middle of an appointment here. We've done step 1, now we're on to step 2. So you'll see with our candidate how she adapts her introduction to show that awareness. I've just finished that examination and now we're moving into discussion. You'll also notice she doesn't fully reintroduce herself. She goes into the conversation, right, and uses the patient's name and the parent's name as well. Now for her, she asked for those names before starting the role play, which all of us can do in our exam. Ask your interlocutor in those 3 minutes of preparation, what name would you like me to use for the patient as well as the parent here? Now, you'll notice on my screen as well, I've highlighted some things. So with the candidate in our role play, we were working on stressing the key words so that the examiner hears those words clearly the first time they're said. So you'll notice here words like mood, sleep, appetite, chickenpox, and lots of them are highlighted throughout. We could highlight even more down here in the task number 1, 2, 3, 4, 5. We could even highlight words like blister and infection, but these are the ones we were focused on to really bring that strength when you are speaking. So word stress is key. A lot of the time, we don't slow down and emphasize the key words. Everything is said at the same level, but you'll notice that there is an enhanced clarity with that enunciation and that stress on our words. The other thing is it gives us a place to land when we're talking. So for example, chickenpox. What is it? Well, it's usually a mild disease, and it gives you a natural end to your phrase or a place to stop and emphasize before moving on to the next part. So you'll notice that stress coming out. You'll also notice I've written slow down a few times, and this is advice for everyone. So when you are explaining, this is often requiring you to think quickly and to connect words and create grammatically correct sentences. So slow down when you are giving information, when you're giving the diagnosis, when you're advising the parent. Take time, because if you do it too quickly, you'll find your grammar is just not that accurate and you're going off, you're coming back, you're repeating yourself because you're not taking the time to think strategically about what you're saying and sharing with the patient. Now, the other important part of slowing down is this is new information for your patient. The patient, as we see in the role play, doesn't know what chickenpox is. So this is new for her. And therefore, everything should be slowed down so that she can absorb it and then she can ask her questions as well. So keep that in mind. If you are a fast talker, you may need to work on that pacing where you are maybe faster to start and then you slow down and you return to that natural pace. Finally, with our candidate, I was working with her on a variety of responses. So often we get familiar with one phrase, and then we use that one phrase every time we are checking in or every time we are responding to questions. However, for our exam, we need to show a variety of phrases. We want to show the examiner we know multiple ways to say the same thing. We can respond spontaneously with that variety. So you'll see on the right side, I said, is that clear? How does that sound? And you'll hear our candidate use quite a few examples throughout when she is checking for understanding. Finally, summary. So our candidate, when I was working with her, she said she usually summarizes at the end of her role play, but due to time management, it's very challenging to leave enough time to finish your tasks and actually summarize. So I encouraged her, use summary statements within your role play. They don't have to be long, they can be brief. These work as a clarification check as well. So you'll hear her in the role play. She will say, after I've told her what my child's symptoms are, she will double check and she will confirm that she heard correctly before moving into the diagnosis. Now, from an examiner point of view, when you confirm what you heard, that is both clarifying, so inviting further information, checking that you actually heard, and it's also acting as a summary. So it's touching on different skills when you are doing that. So let's now move to hearing the full role play. You'll notice there's a timer at the top of my camera there, and that's great if you are practicing to keep track of how long your tasks are taking. So let's go to that now, and then we'll have some comments afterwards.
Hi, Rachel. Now, I just completed the physical examination of Kate. Before we discuss about the diagnosis of Kate, can you please tell me how is Kate has been feeling during last few days?
Yeah, well, I'm not exactly sure what's going on. I know that she has a rash and a mild fever over the past 3 days, so things have not been good.
Mhm. Yeah, yeah. Sorry to hear about that. And how she has been, can you please tell me more about her mood?
Yeah, well, she's been very low energy, quite lethargic over those 3 days.
Sorry to hear about that. And how about her sleep?
She hasn't been sleeping well either, which is probably contributing to the fatigue.
I can understand you are having a problematic period. And what about her appetite?
She has almost completely lost that as well. She doesn't want to eat anything.
Okay, sorry to hear about. Just to double check whether both of us on the same page. Kate is having a fever like 3 days with the rash, and at the same time she is having lethargic. She's lethargic and sleeping disturbance, and at the same time she is having loss of appetite. Is that correct?
Yes, exactly.
Okay, okay, Rachel. So, according to the history provided by you and according to the examination findings, I am suspecting chickenpox. Have you heard about it?
No, I haven't.
Okay, then let me explain a little bit about chickenpox. Is that okay?
Yes.
It's a very common disease, a mild disease, and we can expect quick recovery. Does that sound good?
Yes, that's wonderful news. Thank you. I will just ask though, is chickenpox contagious? So, for example, if is my daughter able to go back to school now, or is it going to spread for other people?
Yeah, yeah. Yes, Rachel, it's a very good question. Yes, chickenpox is contagious. So approximately we have to take care of 2 3 weeks until fully recovered. It's better if you can keep Kate at home during this period because we have to be careful until spots form scabs. Usually it will take 1 week. Is that clear, Rachel?
Yes, that is. Thank you. Now, I will say I also have a 10-month-old son, and
I
I'm
see.
now worried he's going to catch it. Is that likely?
Um, yeah, it's a very good question. You told that your son is 10 months, right? Yes, it's chickenpox, as I mentioned before, it's contagious and it's like there is a chance of getting your 10 months old child also. There's a chance of spreading, but nothing to worry. We can expect similar recovery in both siblings. So usually we are not considered dangerous for 10 months child. How does that sound, Richard?
Oh yes, that's good news if it's not as serious or as dangerous for him. In terms of the next steps, what would you advise from here?
Yeah, very good question. Because we have to very careful about a few things, like we have to be careful about dehydration. So if you see any feature of dehydration, like child feels very thirsty or any change around his eyes, we have to be careful. Another thing is you have to be very careful around the blisters, uh, just to check whether the around the blisters are hot or painful, because if so there is a it's an indication of infection. So in this case you have to come back uh, to me. Okay.
Mhm.
um, uh, do you have any other questions, Richard?
Oh yes, thanks for explaining that. So for my daughter, of course, she's quite itchy. So what can I do to help with that?
Yeah, it's a very good question. Because I can prescribe cream. Mention it's calamine lotion. You can apply it on spots, and it will help to reduce the itching. At the meantime, I can prescribe antihistamines. You can buy it from pharmacy. It will also help your daughter to reduce itching. And another important things I would like to mention, loose cotton clothes also very important, because it allows skin to breathe. So it will help. Okay.
Now that we've seen our candidate sample role play, I want to talk about 3 tips for her to continue practicing to enhance her score. And the first one is continuing with stressing these words. Every new role play will have different nouns, verbs, adjectives, and adverbs that carry the main meaning. And so, keeping this in mind in your exam, even though you're not able to highlight directly on your role play card if you're on the computer, then just note those words. Those are the ones I want the examiner to hear really clearly come through. So that stress practice is something to keep continuing. The second one is continuing to adjust pacing. So moving into that slower pace with giving the diagnosis and advising the parent, making sure that you're taking a breath, you're taking that time to structure your advice as well, with first, second, third, or do this, also this, and another thing is this. Really being organized in a logical way with how you're sharing that advice. And finally, with the variety of phrases that we talked about before seeing the role play, making sure that that is now becoming automatic. So, step 1 is to practice with the variety of phrases. Step 2 is start to use them in the role play. And step 3 is reaching a level of comfortability with those phrases to the point where it is automatic, it is spontaneous that you can use this variety depending on what the patient is saying. So I hope you learned something from this role play with our candidate, and I look forward to seeing you there in the next video.